Myalgic encephalomyelitis, chronic fatigue syndrome, or ME/CFS for short, is a chronic disease which can be debilitating. As well as chronic fatigue, people with ME/CFS experience a multitude of symptoms, particularly post-exertional malaise or symptom exacerbation, and this can be in response to a minor level of activity.
We created the UKME CFS Biobank after learning from people with ME of the importance of accelerating research. The steering committee is chaired by a patient representative, and at least one person with lived experience participates in the decision on every request for samples. The biobank has enabled high-quality research by many globally. A recent partnership with colleagues in Canada illustrates time and cost effectiveness. Once received, the samples were scanned for all known human viruses, with initial results ready in 3 months.
One of the things that makes the UKME CFS Biobank unique is that we include people who live with severe and very severe ME/CFS, and they've contributed data and samples, sometimes at many time points. My visits to homebound participants were initially funded by UK ME/CFS charities, but later by the US NIH. It has been an enormous privilege to meet with these individuals, to hear their stories, and of their longing for recognition of their disease, which our visit provided, but above all, for robust biomedical research. We also have samples from healthy controls and people with MS, although these are at just 2 time points.
Biological samples from people living with ME/CFS are essential if we want to understand the disease better and to be able to develop effective treatments. So storing samples in the UK ME/CFS Biobank means they're a central resource for researchers who could otherwise not study ME/CFS. And we've got this resource of over 30,000 samples which have been collected at different time points from individuals, from people with mild and moderate ME/CFS, from those who are severely affected, who are often housebound or bedbound, from people with multiple sclerosis as a control group, and also from healthy controls. The samples are stored securely using standardized protocols so that high-quality samples from well-characterized individuals are available in a very cost-effective way to other researchers to enable their research to go forward. Any sample from someone with ME/CFS is precious, and this means that the maximum value can be obtained from each sample. So all in all, it's a very valuable resource for the global research community.
The samples from the UK ME/CFS Biobank contains information about people who are living with ME/CFS, MS, long COVID, or even healthy controls. We are focusing on the visits when we are seeing our patients on the blood draw, including the clinical test for screening, as well as questionnaires. The questionnaires are validated as well as bespoke. The validated questionnaires contain the medical outcome survey as well as the general health questionnaires. We are focusing there on the experience of symptoms, including the Epworth Sleepiness Scores, which is focusing on pain and fatigue. These questionnaires include the experience about the symptoms that people are having, as well as sociodemographic variables over time.
The UK ME/CFS Biobank has been storing its samples at the Royal Free Biobank since 2012. During that time, it has been one of our most active clients, continuing to store samples and, most importantly, releasing them to the researchers internationally researching ME/CFS.
Our research focuses on the immune response in people with ME/CFS, and particularly their response to a family of viruses called the herpes virus family. We believe that people with ME/CFS are unable to control the herpes viruses and that the viruses reactivate, causing the symptoms in these people. We're using cells collected from people with ME/CFS that are stored in the ME/CFS Biobank, and that enables us to conduct our research very effectively.
The application process is fully explained on our website, where the outline application form can be found. Once completed, this should be emailed into the biobank and will then be reviewed by the UK ME/CFS Biobank Guardian Board before a full application is requested. We encourage applications for free samples from interested researchers who can submit an application that demonstrates that their aims are in line with those described. please go to our website to find full details of the process and timeline. A successful biobank is one where samples and data are distributed.